Hello everyone, in this video we are going to talk about enzyme inhibitors. We already know what is an enzyme. So right now we are going to talk about what is an inhibitor. Inhibitor is a molecule that binds to an enzyme and slows down or stops the enzyme's function. So easy, isn't it? How enzymes can be inhibited by other molecules. There are two different types of inhibition that can be done for the enzyme. The first type of inhibition is competitive inhibition, and the second type is non-competitive inhibition. Let's see what's the difference between competitive and non-competitive. In here, we have an inhibitor that fits the active site. This inhibitor is fitting the active site and prevents the substrate from entering. So if the inhibitor is fitting the active site and prevents the substrate to go in, then that would be a competitive, which means that inhibitor is competing with the real substrate. So this is the reason we call it competitive. What about a non-competitive? In case of non-competitive, the inhibitor fits into an allosteric site. What is allosteric site? It's here. There is a site in other parts of the enzyme, and the inhibitor is going to fit with that site. And then what happens if the inhibitor fit in that site? It causes the conformational changes. If you see here, so the form will be changed. It is not exactly the same as the substrate form, so in that case it cannot fit to the active site. So that's why we call it non-competitive. In this case, inhibitor is not competing with the substrate, but inhibitor is indirectly changing the conformation of the active site by attaching to the allosteric site so that the enzyme cannot work anymore. Let's see how can we interpret this graph. First of all, look at this picture. There are more numbers of inhibitors, 1, 2, 3, 4. The more number of the inhibitor, the more function of the inhibitors, and the less or the slower the rate of reaction. This means that because the number of the inhibitors are high, they don't allow and they don't give the substrate a single chance to attach to the enzyme. So that's the positive correlation. When we have more inhibitors, they don't allow the substrate, and there is a less chance for the substrate to attach to the active site. But once there is one inhibitor per one substrate, then that would be a 50-50 chance. In that case, the substrate can have a chance, or comparing to this one, if we say number 2, so number 2 comparing to number 1 has more chance to attach to the active site and to be reacted with the enzyme. Okay, so let's go to this graph. What happens here? We have 3 different colors. Let's focus at this stage. So here we have with the constant amount of the let's say at this stage with the constant amount of the substrate, then that would be the in the graph that would be here and here. Okay, what we can see When there is no inhibitor, you will see the enzyme activity. How much is the enzyme activity? Having a higher enzyme activity. When there is a 25% inhibitor, the enzyme activity slope is a little less, and the activity is going less activity. And in 50%, then less. So with the increasing of the inhibitor from 0 to 50%, well, we will see the decrease in the activity of the enzyme. So this is how you can interpret the graph. And once they are reaching to a certain point, then that would be the maximum capacity of the enzyme, which we talk about it later. But at the end, you will see that all of them reach to a point at the same constant at the end, which we discuss this later as well. Again, if we want to talk about what I just explained, you will see this airline as well. Even with competitive inhibition, the same maximum rate of reaction will be achieved if more substrate is added, because we have not changed the number of enzymes available. So because the enzyme available is still at the same level, the only thing is when there are more inhibitors, if we increase the number of the substrate, then the competition between the substrate and inhibitor will increase, because this is a competitive inhibition. So in competitive inhibition, if we increase the substrate, then we can get the more chance of attaching the substrate to the active site. Here we have a nice example of competitive inhibition. I'm not sure if you have heard about this, but that's not something as a common that you have heard before. But once you learn, I'm sure that would be very interesting for you as well. So this is the metabolism of ethanol. Ethanol will be oxidized to acetaldehyde in a regular process in a metabolism or metabolic pathway. And then by the aldehyde oxidase as an enzyme, it will be converted into acetic acid. That's how the ethanol will be converted to the final product as acetic acid. Well, what happens if some drugs will be used? First of all, antabuse. Is it a good thing or bad thing? So it depends. This will be prescribed by the doctor for alcoholic people. Why for alcoholic people? Because alcoholic people they just want to drink alcohol. This drug will be competing with the aldehyde oxidase. It doesn't allow, because it's in competitive inhibition, and it doesn't allow the production or the conversion to the final product of acetic acid. And then what happens? The amount of the acetaldehyde will be increasing. And there are some symptoms and consequences of the increased level of the acetaldehyde, and that would be causing to nausea, which causes like bad feeling and vomiting feeling, and then that's a good deterrent or discouraging. That's a good discourage for the people of drinking. But the usage of the antabuse pills depends on the motivation of the person who is alcoholic. If anyone stops taking the pill daily, then this means that he can take alcohol again and start to drink again. The next one is non-competitive inhibition. As I explained before, it's really simple because instead of competing directly with the substrate, it attaches to some area of the enzyme which is called allosteric site, and by attachment to the allosteric site, it changes the conformation of the active site, and it doesn't allow the substrate to be attached to the active site anymore. So that is called non-competitive inhibition. And the graph would be almost the same. By increasing the amount of the inhibitor, then if you look at, for example, here, if you look at this stage, then you will have different levels of enzyme activity according to the number or the amount of the inhibitor. So the more inhibitor, then that would be the less enzyme activity. With the red, you see that at this point is less activity, then this one, and then this one. Example of non-competitive inhibitor can be RAA system, which is related to controlling blood pressure. In this system, the production of angiotensin enzyme, angiotensin 1 by the angiotensin converting enzyme to angiotensin 2, these are a series of reactions that the presence or the production of the angiotensin 2 will cause the vasoconstriction. These definitions, you will learn about them in human physiology. You don't need to be worried about these things right now. If you don't know what is vasoconstriction, it's okay, because we will discuss this in the human physiology. But just simply explaining what is vasoconstriction is that here is the normal blood flow. So the blood can normally go through, and here is when there is a restriction on the blood flow. And with the action of vasoconstriction, then the blood pressure go higher, and it causes problem for the people who has heart problem or blood pressure problem. So what happens, the doctors will prescribe medications which is called ACE inhibitors. ACE inhibitors will act at this level, and it compete with the angiotensin converting enzyme. With this enzyme, this competition would be in the form of non-competitive, not the competitive one. So it is the non-competitive, which means that it changes the allosteric site and the conformation of the active site. So in this case, the production of the angiotensin 2 will be delayed or will not happen, and in the following, no vasoconstriction, because the vasoconstriction is something which happens here. The vasoconstriction will causes the increased blood pressure, and when there is a restricted blood flow, then that would be a blood pressure from the heart side, and this happens when the presence of the vasoconstriction.
Almost all therapeutic drugs are enzyme inhibitors, from old medicine box standards such as aspirin and penicillin to the newest compounds used to treat HIV infection. Understandably, enzyme kinetics plays an outstanding role in this effort to produce effective therapeutics. For kinetic studies can quantify the degree that inhibitors inactivate or slow down the targeted enzyme's catalytic rate and describe its potential efficacy as a drug. In addition, many naturally produced toxic substances and chemical warfare agents are also enzyme inhibitors. For example, a peptide found in snake venom became a lead compound in the development of a class of hypertension drugs that inhibit angiotensin-converting enzyme, or ACE inhibitors. The nerve gas sarin is a potent inhibitor of an enzyme important for synaptic transmission in nerve tissue. Enzyme inhibitors alter the activity of an enzyme by decreasing the enzyme's ability to bind substrate, lowering its catalytic turnover, or both. There are two main classes of enzyme inhibitors, reversible and irreversible, that are differentiated by their magnitude of their affinity for enzyme. Reversible enzyme inhibitors bind and dissociate with their enzyme in an equilibrium process. Irreversible inhibitors bind tightly to an enzyme to form an essentially permanent complex. Because they form such a tight complex with enzyme that they permanently remove its catalytic activity, irreversible inhibitors are also termed inactivators. For example, kinetic studies on the male pattern baldness drug finasteride, or Propecia, reveal it to be an essentially irreversible inhibitor of the 5-alpha reductase. This enzyme catalyzes one step in the conversion of testosterone to dihydrotestosterone, which is a hormone implicated in hair loss. Some irreversible inhibitors even become covalently bound to amino acids in the active site of the enzyme, as they are brought through the early chemical steps of catalysis. Aspirin is such an example. Reversible inhibitors can be classified as competitive, mixed, or non-competitive inhibitors. If the detailed mechanism of inhibition is known, then the classification can be made by identifying where on the enzyme the inhibitor binds, or the order with which it binds relative to substrate. Alternatively, a determination of simple kinetic parameters can generally be used to classify the inhibitor. Competitive inhibitors compete with substrate for an enzyme's active site, lowering the enzyme's likelihood of binding substrate and slowing the observed reaction velocity. Kinetic studies can be used to determine the type and potency of inhibition for an unknown inhibitor. Typical steady-state kinetic experiments can be performed where reaction velocity is measured in the presence of varying concentrations of substrate. If inhibitor is then added, and the data shows an increase in Km, yet the Vmax is unaffected, this is the signature of a competitive inhibitor. A mixed inhibitor binds to a site on the enzyme and interferes with both apparent substrate affinity and catalytic turnover, thus affecting both the observed Km and Kcat for the enzyme-catalyzed reaction. Mixed inhibitors do not bind directly in the active site and therefore do not block substrate binding, but instead bind at sites that can be proximal or distal from the active site. Mixed inhibitors can therefore bind to free enzyme prior to substrate, distorting the active site to a non-optimal conformation for catalysis. The inhibitor-distorted active site has trouble converting the substrate to product before it dissociates, resulting in a lowered apparent substrate binding affinity. Mixed inhibitors distort the active site, interfering with the chemistry performed by the enzyme. Therefore, the enzymatic turnover rate is slowed. Mixed inhibitors can also bind after substrate to the enzyme-substrate complex. Similar to before, the inhibitor binding to the ES complex distorts the active site and its bound substrate to a non-optimal conformation, so that less ES complex productively form product before the substrate dissociates. Binding of the mixed inhibitor to the ES complex also interferes with a subsequent chemistry step. Steady-state experiments performed in the presence of a mixed inhibitor demonstrate an increase in Km and a decrease in Vmax. Remember, Vmax is simply Kcat multiplied by the total enzyme concentration. Therefore, a decrease in Kcat is a decrease in Vmax. Noncompetitive inhibition is a special case of mixed inhibition where the affinity of inhibitor for E and ES is the same. Steady-state experiments performed in the presence of a non-competitive inhibitor demonstrate a decrease in Vmax, yet Km is unaffected.